Today in mental health, under pediatrics mental health, we're going to look at attention deficit hyperactive disorder. Now, when we talk about attention deficit hyperactive disorder, this particular disorder is common in children. However, if the child crosses a particular age without this particular disorder clearing in this particular child, now it is seen as a mental problem. When you look at a child in normal circumstances, children react without thinking at a particular age. Children will react in a manner that they cannot just focus on one thing. You'll be in church, this particular child will just keep on running up and down. Even if you try to make them stop, they won't stop. But we expect that as this child exceeds a particular age as a child, this behavior has to clear away. And if it does not clear out, this condition now manifests into what is known as attention deficit hyperactive disorder, such that if not properly managed as a child, it may still progress in adulthood, and this adult may still have this particular disorder. So now, how can we define attention deficit hyperactive disorder? So this condition can be defined as, of course, children with attention deficit hyperactive disorder. These are children who show a persistent pattern of inattention or hyperactivity with impulse behavior that interferes with functioning and development, and it should be present for at least 6 months. So once this particular behavior is seen continuously for a minimum of 6 months, then we're able to classify this child as having ADHD. And the common characteristic is that this particular child cannot pay attention to one thing at the same time. They have impulsivity or react with impulse. Reacting with impulse means that this particular child is acting or reacting without thinking. This is because as a child or as an adult, whatever we do, whether good or bad, we still think about it, about our action and what we should do next. But this child with ADHD, they react without thinking. They will just do whatever they feel like they're doing without thinking through about the consequences. Now, when we talk about ADHD, of course, these are just other definitions that we can use. Now, in terms of assessing a child with ADHD, we normally concentrate on what is known as the American Academy of Pediatrics recommendation on how we should assess a child with ADHD. And this type of assessment in trying to identify a child with attention deficit hyperactive disorder, we depend on asking the parent how the child has been behaving, the teachers, and of course other adults who care for the child about what the child's behavior is like, for example, at home, school, or with friends. And once we get more information about how the child's behavior is, whether the child is able to concentrate or not, then we're able to tell that this particular has ADHD. It's because it's not easy for you to diagnose ADHD with just one-time interaction with the child, because you may not have known the type of behavior that the child has been exhibiting throughout. Of course, in terms of diagnosing ADHD, we use a combination of what is known as inattentiveness, hyperactive, and of course impulsive behavior in children. And this is recognized as a disorder when these behaviors are severe or developmentally inappropriate for that particular child's age, or they impair the functioning of this particular child at home or at school. Then we're able to diagnose and tell that this particular child has ADHD. Amongst the signs and symptoms that we see in a child with attention deficit hyperactive disorder is that, of course, the child may have trouble focusing and, of course, behaving at one time or another. Apart from that, children may not grow out of these particular behaviors. For example, like I mentioned in the introduction, such behaviors may be normal in a particular child at a particular age, but you expect that as the child continues growing, these behaviors should move out of this particular child, but they do not grow out of them, and they remain fixed in those same behaviors of trouble, just having trouble focusing on one thing. Apart from that, of course, these symptoms of ADHD, of lack of focusing, which is the main characteristic or main symptom, may become severe such that the child may have difficulties in school, at home, or even with friends, because they can't concentrate on one thing, they can't focus on one thing. So even in school, they will have difficulties because they will keep on running up and down. Of course, more other specific symptoms, it includes daydream a lot. This child will be sleeping mostly in the day, and they'll be dreaming most of the time that they are sleeping. Then you know to say that the child may be having ADHD. Forgetting or losing things a lot is also a symptom, because the child cannot focus on one thing. So they will mostly be forgetting or losing things because they keep on moving up and down. They squirm or fidget. They can't just sit at one place. They keep on looking left, right, center, all over, like they are looking for someone or something, or there's something that is interesting them. So they are always fidgeting, also what is known as squirming. They talk too much. They can't just keep quiet, but they'll keep on talking. They have that pressure in speech as they speak. They make careless mistakes and take unnecessary risks as well. They'll just jump where they don't need to jump, even when the height is too much for them. So they'll take those unnecessary risks. Apart from that, also, they have had or difficulties time resisting temptation. Whatever someone tells them to do, they'll do it because they can't just resist it. They have trouble taking turns. They will just have difficulties um, taking turns. For example, they want to turn left or to turn right, they will have difficulties. They will keep on moving straight, running up and down, or in situations where they are playing with other children and they have to take turns in terms of activities, where they sit, another child plays, or and then they continue playing. They have difficulties also taking such turns. Apart from just movements, they will want just to keep on playing and not giving chance to other children. They also have difficulties getting along with others because they don't have the ability to take turns. They want to be playing throughout, to be on top of everything as compared to other children where they are. So they have difficulties getting along with other children. When we talk about the types of attention deficit hyperactive disorder, the first one that we talk about is what is known as predominantly inattentive, and the second one is predominantly hyperactive impulsive, and the third one is combined, which is inattentive and hyperactive impulsive. So when we talk about predominantly inattentive, such children with attention deficit hyperactive disorder with predominantly inattentive, they have difficulties to organize or finish tasks. At the same time, they have difficulties paying attention to details or to follow instruction or conversations. And of course, the person is also easily distracted and forgets details of daily routines easily. So once we see this characteristic in a child with ADHD, then we'll classify them as having a type of predominantly inattentive. The next type is predominantly hyperactive impulsive. So in this particular type, this child fidgets or talks a lot. Apart from that, it is hard for such a child to sit long for either meals or while doing homework. Smaller children may also run, jump, or climb constantly because they cannot just sit quietly at a particular time. Apart from that, the individual feels restless and they have trouble with impulsivity. They will have trouble thinking through before they react, meaning that most of the time such children will react without thinking. And someone who is impulsive may also interrupt others a lot, because they cannot just think through what they're about to do, and they cannot just sit quietly. Apart from that, it is also hard for the person to wait their turn or listen to directions. They cannot wait, like mentioned amongst the symptoms. Also, the impulse that this particular child has may easily cause more accident and injuries to even others, because this child cannot think through before they react or do something. The third type is combined, where we see inattentive, also hyperactivity. In this particular type, of course, the child is going to present with both of the symptoms that are mentioned above. Because the symptoms can change over time, the presentation may change over time as well. So this particular child may have a combination of these particular symptoms being seen in this child. Amongst the causes of attention deficit hyperactive disorder, mostly ADHD is linked to genetic factors, because the actual cause of ADHD is unknown. Of course, other causes of ADHD are still linked to factors like brain injury. The child may suffer from brain injury. It could be a number of exposure to a number of conditions like asphyxia, or premature birth, or RDSD. All this can easily lead to brain injury. Also, just physical brain trauma, where the child is maybe dropped or in an accident. All those may easily cause brain injury, which may easily result in attention deficit hyperactive disorder. Also, exposure to environmental risks like lead exposure during pregnancy or at a young age also predisposes a child to ADHD. Tobacco and, of course, alcohol use during pregnancy may easily lead to what is known as the fetal alcohol syndrome, especially where a pregnant woman is taking alcohol, and all that may cause developmental challenges to the brain of this particular child. Premature delivery, like I've mentioned, because the brain is still premature, and maybe even after the child or this premature baby is born, the nutrition is not adequate enough. This may not provide sufficient nutrients for proper development of the child. Low birth weight is also an indication that this particular child was also receiving less nutrients, and this may easily cause underdevelopment of the brainy tissue. So when we talk about the causes of ADHD, these are some of the causes that we can talk about, including the risks, of course. Diagnosis of attention deficit disorder involves a number of processes, but there is no single test that we can use to diagnose attention deficit hyperactive disorder in mental health. But the medical exams that are used to diagnose ADHD may include the hearing and vision test, just to rule out other problems that may have symptoms similar to ADHD. And of course, this may include rating tests, like in terms of what the parent has told you about how the child's behavior has been, the teacher, and of course the child themselves. They may, if they're able to talk, they may still verbalize how they have been experiencing life and also reacting to life. So when we talk about a diagnosis, mainly it is dependent on the guardians, the teachers, or anyone who's a caretaker who has been responsible for that particular child. But it is difficult just to do a specific test to diagnose attention deficit hyperactive disorder. When we talk about treatment for ADHD is focused on family therapy, of course, a combination of behavioral therapy and some medication, and medications are just dependent on probably neutralizing or normalizing serotonin levels. Probably that will make the child become calm and avoid moving up and down. And of course, what works best is dependent on the child and the family themselves, how the child is able to respond. and hence it's difficult to give medical treatment or specific treatment to a child with attention deficit hyperactive disorder. But when we focus more on psychiatric management, this is where we can do certain therapies to try and help the child change that behavior and probably have a normal behavior that they should now adopt or adapt to in adulthood. And this may include behavioral therapy. You can do positive reinforcement for good behavior, consistent rules and consequences, reminding the child about this so that the behavior is changed, using a token of economies charts or rewarding system, so the child can be given a token of something for performing well or for demonstrating good behavior. You can use charts to try and teach this particular child. The rewarding system, all these are behavioral aspects that you can use to change the child's behavior. Parent training in behavior management is also cardinal, and in this one you educate the parents on ADHD and effective discipline strategies that they can use. Rather than them just saying this is the way this child is, they can do something about it to try and change the behavior of the child and make the child have a good behavior. You can also it can also help reduce parental stress and also manage challenging behaviors as well. Cognitive behavioral therapy can be used, of course, for older children and also adolescents. You can teach the child coping strategies, problem solving strategies, self monitoring, and of course, emotional regulation. All this can promote or help development of good cognitive behavior. And of course, other aspects that can be used is educational support. Since ADHD mostly affects academic performance or school involvement, hence educational support is essential because you want this particular child to also have a normal education system, and this can be achieved by having an individualized educational plan specifically for this particular child so that you help them develop better. You can also use teacher training so that teachers understand ADHD and how to use adaptable methods to such children. Structure classroom environment with clear instructions so that when a child breaks them, they know the consequences and they may mostly avoid breaking these consequences willfully because of their ADHD. Family and social support can also be applied. You can do family counseling so that you address any parental stress, sibling rivalry, or support system, strengthening it so that this child has enough support for itself. Encouraging support groups, promoting healthy lifestyles, all these are interventions that can be used. Long-term management may be related to long-term planning for this particular child, like transitional planning as the child moves from adolescent to adulthood. All this can be applied to a child and how the child can still adapt rather in adulthood. Addressing comorbidities like depression, anxiety, conduct disorder, or other learning disability like intellectual disability can also help solve ADHD because the child may be having ADHD, not knowing that they also suffer from another neurological problem or disorder. You can promote a life skill training, social skill training, also vocational training in a child as you promote development of this particular child. So that is about attention deficit hyperactive disorder. So the reason we have learned attention deficit hyperactive disorder, this condition may look very small, but if you ask those who attempted, of course, the November, December 2025 mental health, this condition was part of the exam. So no matter how this condition looks small, it is cardinal that we read about it and it is cardinal that we learn about it. So any condition, we are going to try as much as possible to tackle it and do not eliminate any condition no matter how small it may look. Till next time, goodbye.